Welcome to Hey Dr. Sue. So people submit their sex questions to me anonymously, and once a week I post one question and one answer. Do you have a sex question you've always wanted answered? Go ahead and check out the description for information on how to submit it anonymously. This week's question is, I'm trying to understand my porn addiction, if it's even right to call it that. I want to just understand what it's doing to my physiology and nervous system. So I want to start by saying that I am one of the many sexologists who believes that porn addiction isn't the right term. And I want to explain why before I answer the rest of your question. When we talk about addiction in regards to substances like alcohol and other drugs, there are certain criteria that need to be met for it to fit that diagnosis. There are 11 criteria in all, and you need to meet 2 of them for it to be considered a mild substance use disorder. If you meet 4 or 5, then it's moderate substance use disorder. If 6 or more apply to you, then it's a severe substance use disorder. I don't usually like to include lists of things, but I think it might be helpful for this video. But instead of reading it to you, I'm going to have it on the screen. You can pause it. There's actually 2 screens to make sure you see them both. It's an edited list, an abbreviated list, I should say, that's taken from the DSM-5 TR. So I'll give you a second to pause. If you couldn't pause fast enough, you don't want to go back and read it, you can also just go to the website where I grabbed this from, which is the Cleveland Clinic, and the link to that is included in the description. One of the many reasons why professionals do not think of compulsive porn use as an addiction is because it doesn't have a list of criteria that we can use to diagnose this. So you may look at the list of things that I put up for substance use disorder and think like, wait a minute, I meet a lot of those with my porn use, which is why I want to introduce a different label, compulsive sexual behavior disorder, which comes from the ICD-11. And these can be summed up, and I'm actually going to read these, but they're also on the screen if you want to pause and read them yourself. 1 is a persistent inability to control intense sexual impulses or urges. That's a little more towards sexual behavior than it is porn. Repetitive sexual behaviors, including watching porn, becoming a central focus of life. Repeated unsuccessful efforts to reduce the behavior, which I'll come back to. Continuing despite negative consequences, which I'll come back to. And continuing even when little satisfaction is obtained. So what that means is that whatever relief you used to get from porn, you're not anymore. There are a few things I left off this list that I'll apply directly to porn. 1 is that your porn use causes significant distress, but that distress has to be about your use, not about any kind of moral or religious issues. So if you're watching a lot of porn and you don't think it's a problem, then I would lean towards it's probably not a problem for you. The other is that you've tried to limit how much porn you watch and have been unsuccessful. And all of these things have been happening for at least 6 months. So whether or not you meet the criteria for compulsive sexual behavior disorder is something only you can answer. What I can help with is the what's going on with my body and brain part. And part of this is tied to dopamine. When you watch porn and it helps address something, whether that was building sexual tension or boredom or anxiety or whatever else led you to look at porn, your dopamine level starts to rise. This is because your brain has learned that watching porn is going to give you some type of release. You watch porn. If you orgasm, your brain and body are going to feel really good. In addition to dopamine, your brain and body are going to be flooded with things like oxytocin and endorphins. The thing that led you to watch porn and masturbate may not be as much of an issue anymore. The sexual tension? Gone. Bored? Not anymore. Stressed? Not now. Now you feel relaxed. And so this creates a habit cycle in your brain. This isn't a problem in and of itself. We have these types of habit cycles for a lot of things, often without us realizing it. It starts to become a problem if your use of porn is the only way you can deal with things like stress and anxiety. It can also be a problem when you're watching porn instead of doing other things that need to be done, like going to work or school, or when your relationships with significant others, friends, or family start to be negatively impacted by your porn use. If you want to stop watching porn, or at least limit how much you are, and you're struggling to do that, then that's when it's gone beyond just a habit cycle, and we may actually start to see different kinds of changes in the brain. If you feel like you have to watch porn instead of feeling like you want to, that may also be a sign that your brain is looking at this in a different way other than just a habit. I'm not sure if all of this helped or simply overwhelmed you. If you need more information on any part of this or this has raised more questions, feel free to reach out. The link to do that is in the description. Until next time, be safe and have fun. Did you like that video? If so, make sure to like and subscribe to the channel. That way you'll know when new videos come out. Also check out the description to find out how to find me on Instagram, Medium, and Threads. And make sure to check the description for links where you can submit your own sex question.